street theatre in the heart of India's capital, Delhi. An entertaining way of making a serious point. These performers are dramatising the dangers of unprotected sex. In a country where 4 million people are HIV positive, getting the message across is a matter of life and death. A few months ago, another more high-profile performer brought attention to the cause of AIDS in India. Hollywood actor Richard Gere visited Delhi to open a care home for people suffering from HIV and AIDS. Gere has given $50,000 to fund the home, a much-needed boost for AIDS sufferers and activists alike. The new 20-bed centre is one of only a dozen such facilities caring for an estimated 4 million Indians infected with the HIV virus, with some reports predicting that the number could rise to 20 or 25 million by the year 2010. AIDS activists here say much more needs to be done, both to combat the disease and to care for its sufferers. The Indian government says that such predictions are scaremongering and that the country is coping with the crisis. AIDS activists have taken matters into their own hands. This information campaign on the streets of Delhi is sponsored by the non-governmental organisation, the AIDS Awareness Group. They're explaining the virus and the basics of protection to passers-by. Awareness about the use of condoms varies from state to state in India. In general, men in cities and large towns are much more aware of the problem than men and women in rural areas. The awareness group also runs health clinics on the capital streets. Doctors are on hand to give checkups to passers-by, administer basic treatment for sexually transmitted infections, and refer patients to specialists if necessary. Information campaigns have also been aimed at areas like GB Road at the heart of Delhi's red light district. Commercial sex workers are among the highest risk groups in India when it comes to contracting HIV. There are some 80 to 90 brothels here, containing nearly 3,000 prostitutes. A government scheme is meant to provide free condoms to sex workers, but health activists say the supply is hopelessly inadequate. Small wonder that some refer to this street as India's AIDS factory.
Unless the government wakes up and takes very drastic action at various ministry levels, the situation about spread of HIV will be totally out of control and it will reach an alarming figure. Could be 25 million for all I know, but at the moment the government is not able to cope. It is not giving adequate funds to the people who are working in the field, to the voluntary sector, to condom distribution, supply and distribution, to adequate equipment in hospitals for all this. So therefore I am very alarmed with the present situation.
Hundreds of miles away in Hyderabad, capital of the southern Indian state of Andhra Pradesh, the HIV virus has taken a fast hold. Analysts say the state is one of the worst affected in India, largely because of the high numbers of migrant labourers and truck drivers who patronise prostitutes. The disease is quickly spread through the population when infected husbands return to their villages and their wives. Instead of buckling under the weight of the problem, though, Andhra Pradesh is credited with being one of the few Indian states to square up to the disease. Conditions in this government-run hospital unit for HIV-positive patients in Hyderabad might look basic, but the fact that it exists at all is unusual. Most Indian government hospitals are reluctant to admit people suffering from the virus because of staff prejudices or chronic overcrowding. Here at the State Chest Hospital, some 40 people are cared for in a designated HIV care and support centre. There are facilities for HIV blood tests, but because of its cost, antiretroviral treatment to combat the disease is not available. What can be treated are the opportunistic infections caused by HIV, such as TB, fevers and diarrhoea. Doctors here say that their patients represent the tip of the iceberg. They believe there are huge numbers of people who remain ignorant about the disease.
the problem is getting worse because more and more number of cases are coming to light, one. Still, there are many patients who are coming positive, and the incidence reported is increasing as per our voluntary counseling testing center reports and various other reports. The number is increasing, and probably it requires what is called war-footing interventions to control this HIV disease.
Awareness is seen as crucial in fighting the spread of AIDS, and Andhra Pradesh has taken up arms, particularly in the light of a survey recently conducted by the United Nations. It found that public ignorance is the most important factor fueling the spread of HIV across India. This sex education class at the Zilla Parishad Girls' School in Hyderabad is part of a statewide program targeting 1.3 million children in nearly 11,500 schools, the biggest program of its kind in India. In a deeply conservative country like this, where sex is rarely discussed in public or in family circles, explaining issues such as contraception and sexually transmitted infections to teenagers is seen as a major breakthrough. It's the first time these girls have heard frank discussions like these. For those already infected by the virus, the inevitable consequence of widespread ignorance about AIDS is prejudice and discrimination. These men belong to the Delhi network of positive people. They meet to share personal experiences and devise ways of creating greater understanding of the disease among the general public. Group founder Naveen Kumar has experienced prejudice firsthand. He and his family have been victimized for speaking out on television about AIDS and HIV.
After the television show, the landlord saw it and I was not there, I was not at home, and he told my wife, take everything out and keep it on the road. My wife called me up, I came back, and the landlord tells me, please leave because you have infected my house with the virus and I have to call the pest control people to disinfect the house. So I had to leave.
Naveen's wife is currently taking expensive antiretroviral drugs known as ARV to stay healthy. But his greatest worry is what will happen if he becomes sick.
If I have land up in a hospital tomorrow and some doctor identifies me as a person living with HIV, he will not treat me. And without treatment, I'm going to die. And if I die, who will take care of my daughter? Who will take care of my wife? If I die, she cannot support ARV, she dies. She dies, my daughter becomes without the, then she'll live without the parents. And she'll be on the road. Because nobody is going to adopt my daughter also because she is HIV negative, but a daughter of HIV positive parents. So that's our future.
The Freedom Foundation in Hyderabad tries to offer a better future for children whose situation is even worse than Naveen Kumar's daughter. The children here are both victims of the virus and of society's ignorance. In their short lives, they've undergone repeated trauma, having lost parents and siblings. They then have been shunted around by relatives who didn't want them. Government schools and hospitals will not take them, so they have nowhere else to go. Many of them are unwell and susceptible to infections. The Freedom Foundation offers a home and hospital care to 16 children. It's a non-governmental organisation and the biggest facility of its kind for AIDS patients in India. It receives government funding for 10 of its patients, but has to make up the rest. At the time of filming, Ravi was a new arrival.
We don't know about Ravi. He was just sent here by an agency because when he was getting sick, they tested and found him positive, and no agency is willing to keep positive children except Freedom, so he is here with us at the moment. And he's going to be here for a short time. I don't think he's going to last very long, but at least in whatever time he has left, we've decided the best care for Ravi.
The foundation also cares for 17 adults. This man was a stone quarry worker obliged to travel far from his village in search of work. His wife discusses his treatment and diet with a nurse. Her husband is now in the AIDS stage of the disease, suffering from breathlessness and fever. The foundation says that care and support for AIDS sufferers should be given as much importance and attention as AIDS prevention, so their youngest and oldest residents can be treated with dignity and respect. There are few other places in India where children can receive such care and attention. But if India's AIDS problem grows as some predict it will, there will be millions of children like Ravi, who died soon after these pictures were made.